There he goes. That's the rock climber. You lift up and shoulder extension. Go. Fight it, fight it, fight it. Nice.
Dude, that's so clean.
Oh
All right, so we're here at the Bar Vancouver with two calisthenics professionals that are local to Vancouver, and they're gonna be showing me some exercises today. I think one of the big goals in this decade of life is to learn new exercises, new movement, not stick to one thing which has been climbing in the past. So I'm ready to get work today, and I'm really excited.
Yeah, with your skill set with rock climbing and all your other modalities you train, I think you're gonna pick things up pretty fast.
So we have Adair, who owns this gym, and Meghan Callaway, who is a legend in the calisthenics community. So, so yeah, let's get after it.
Okay, so the first thing we're gonna warm up is scapular mobility.
Okay.
We're gonna move the scapula around the ribcage, and we're trying to go in through a lot of movement with the shoulder at the same time.
Okay.
So one of the big issues with moving into a shoulder flexion is compensation of the lumbar spine. So to block that, we're gonna get you on a bench like so. We're gonna go into a little bit of flexion with the lower back. We're gonna grab onto the bench with one arm. From there, I'm going to lift my hand up. I'm gonna extend with the tricep and slowly articulate around. As I come up into shoulder flexion, I wanna make sure I don't go into an anterior pelvic tilt with my lower back. I wanna keep all the work in my shoulder joint and my scapula.
Okay.
Let's go. Yeah. Now stay in that flexion there.
Yeah.
Keep your chest down, keep your chin down.
Chin down.
From there, you're gonna lift your hand up, you're gonna extend the arm, you're gonna reach away from you as far as you can,
Yeah.
and articulate the shoulder and the scapula as you come up to the top position. Point the thumb to the ceiling, it's hard, right?
Yeah,
and
my
reach
mobility is
forward,
bad.
And then come back. So this really shows you how true mobility is. If we had you do this standing, you'd probably compensate from here, right?
Yeah.
Give me 2 more of those on this side. So make sure you're breathing as well too. Use the bench for cueing to breathe into your diaphragm. Reach forward. Nice.
So like, I feel like my shoulder extension over here is quite bad.
Yep.
And I would imagine like when you're doing a movement like
handstand.
a handstand, that would really limit your ability to do that.
So this shows you your true range at your shoulder with minimal compensations, right?
Interesting.
That's why we use this bench as a block. So
Okay.
this really shows your true mobility.
So is this is trainable, right? Like
Yes,
I'm guessing.
100%. Yep. As long as your intensity is high and your intention is there, you can get better at it.
Okay.
Last
Even
one.
at 40.
Oh, 100%. I've had people at 60. My oldest client was 86. They got better.
Okay.
And switch sides.
Okay.
Nice.
And is
The
it
ribs
like?
down.
Oh, okay.
Yeah.
It's weird because like I'm right hand dominant, so the movements on my left arm feel more clunky and don't feel as natural, you know?
Yep. This will get better the more you do it.
Okay.
So the best way to maintain the health of an articulation is to move that articulation.
Okay.
Right? And it's something called articular independence, meaning just the shoulder joint, so you can have articular interdependence, moving that shoulder joint with the rest of the body.
Ah, interesting.
Nice. It's not so bad. This shows you exactly where you're at.
Yeah.
It shows you the health of just that articulation of the shoulder joint and the scapula. If we had you do this freestanding, just standing here, you would start to move everything else around.
Okay.
You could do it on the bench to start. You don't have to. Basically, just like a push-up, but then you're gonna go up and back, and you wanna think about getting the shoulder blades away from the spine and around the rib cage. You could do that, or you can do it from the floor, which is usually, start from the bench and just see how it feels for your push-up, but then as you press up, think about moving, spreading your shoulder blades apart.
Yeah.
Getting it away from the rib cage, or like away from the spine and around the rib cage.
Okay, like around here?
Yeah, exactly. Floor.
Go from the floor? Okay.
Yeah, go from the floor, and then as you do it, your hips are gonna pike up. So you're gonna press up and back. So you're gonna, yeah, there you go. And your hands can be a little bit wider if it feels more comfortable.
Okay.
So just normal push up, and then think about spreading them away from the spine, getting them around the rib cage.
Oh yeah, I feel like I don't ever really train control of my scapula, so I feel like it's like everything feels so like effortful to control like where the positions of the scapula are. Is that okay? Like where does that look okay?
Yeah. No, that's good. And so just again, think about spreading it away from the spine.
Okay.
And getting it around the rib cage.
Yeah.
And then as you lower, it's going to do the reverse. So it's going to move in towards the spine. Super. It's like a basic concept, but you get that, and then all of a sudden everything feels so much better. Your pull-ups, your muscle-ups, your handstands, which I suck at, so I'm not going to do those.
So let's go over this on a bench. So I don't want to dump forward into this position here,
So
right?
everything stays solid,
Exactly.
but the only thing that's moving is your arm?
Yep. So
Okay.
I'm driving into the bench. I'm translating force this way now into the bench. I'm going to lift up. As I lift up, I'm going to go back into shoulder extension.
Interesting. You can actually see your posterior delts just activating immediately.
Without the
Dude,
chicken
you're
wing.
jacked, man. Holy crap.
You're sort of on your
Kneeling.
knees down there. Let's go.
Am I like sitting on my heels or?
Yeah, whatever's
Okay.
comfortable for you.
Okay.
Now this arm, you want to stay adducted to the body as close as you can.
Okay.
Nice and tall, rib cage over pelvis. Good.
I
Now you
can't
get-
even like extend
See,
it
even
off
this
the
position is
bench.
going to be
Yeah.
hard. So what we could do is we could actually modify it and bring you into less shoulder extension.
Yeah.
If you want. Do you want to stand up a little bit higher then?
Maybe let me try this
You
again.
can?
Okay, so
right now, you take a nice inhale through your nose, exhale through your mouth, drive force downwards into the bench. No, go down first.
Go
yeah,
down?
into the
Okay.
bench. Yeah. Now, when I tell you in 5 seconds, you're gonna lift up, but when you lift up, don't have anything roll forward here, okay? So exhale and lift up off the bench. Yes, see, that's true shoulder extension without anterior translation here.
Wow.
And hold that position. In 5, 4, 3, 2, now shoulder extension, go. Let's go, 5, let's go, 4, stay tall, 3, 2, 1, rest. Nice work.
dang, my triceps are spazzed. I know that some people have like their dumb left non-dominant hand, but I feel like for me, almost everything that I do is with my dominant hand.
Yeah, you have to, because you're so precise with your skill,
Yeah.
you have to be.
Yeah,
You can't be like, oh, let's try left hand today.
Yeah.
There's no way. Imagine someone's on the table. Like, oh, let's go left hand. Okay, so now you understand the principle. So
Yeah.
rib cage forward. Yeah, use a bench for reference point. So first you're gonna apply pressure into the bench downward for 5 seconds. Stay nice and tall in 4, 3. Now without dipping forward, go into shoulder extension. Hold it, nice. Fight it, 5, nice. 4, hold it. 3, 2, 1. Let's do that one more time. Drive into the bench and give me 5. Nice and tall. 4, yep. 3, 2. Now actively lift up into shoulder extension. Go, fight it. Nice. In 5, let's go. 4, 3, 2, and rest. Awesome.
Dang.
Good. So
That's
this-
like zero weight and
Yeah.
it's so hard.
So this is called active mobility, right? You're
Okay.
trying to build some actual positional strength so you can translate that to the bar and to other aspects you're doing in your training, right?
Okay.
A lot of mobility people do is very low intensity. You're not
Yeah.
really building the capacity of that joint, of that position.
Yeah.
So you can translate it to skills you want to do for the active, right? So things are way too passive these days,
Okay,
right?
yeah.
Like you can't massage things away, right? You need to build strength.
Absolutely.
Right? So that's what we're
100%
doing.
agree with that.
Right?
Yeah.
Good work, man. All right. So that was like a very general, rough warm-up that we do, right?
Yeah.
The main thing with the warm-up, you want to always train the position you're going to be in through the exercise you're going to go into, right?
Okay.
So you're always going to regret getting injured in the position you don't train in. Does that make sense? So you always want to just open up that, think of the positions you're going to, or the shapes you're in through muscle-ups, through handstands, and just train them and strengthen them independently.
Yeah.
So now you should be good. You know, they're very general, but there's a lot more to it. So I want to see you attempt a muscle-up to the best of your ability, okay?
Like clean muscle up?
As clean as you can.
But keeping in mind the warm-up ones, wow, okay, that was.
One more time.
Oh,
Nice.
Yeah, you're totally good.
I can do,
Easy.
I'll sit once
Easy.
too. But
You can do strength.
You're good.
Nice, awesome. So, yeah, so that's,
Climbing,
that's a really
climbing.
good muscle up, by the way. So the strength is there. So what I want you to try to do on this one is I want you to flex your quads, squeeze your glutes, have no hip movement and no momentum.
Okay.
You can have a slight swing just on the bar to go forward and backwards.
Okay.
But I want you to have no hip flexion when you pull. See if you can do that.
let's try this.
Yeah, so you keep that shape and just pull. Oh, pretty good, man. Pretty
Oh,
good.
that was pretty
bad.
hard.
Not bad.
I feel like turning the bar is harder when you're in that position.
Yeah. There you go. That was better. Nice.
Thanks.
Awesome. Rest. Good.
Thank you.
Nice work.
So I'm gonna get my hand.
Yeah, your wrist mobility is insane.
Yeah,
Because like
so
you're like, see, like it's almost like there's like
you-
an apex over here.
Yeah.
I don't know if I could do
So what
that.
I'm gonna do, I'm gonna get into a dead hang, keep my body nice and tight. I'm just pulling up. And as I go, there we go. Wasn't quite, my legs came up a little bit more than I'd want. I'll do a
crazy.
better one after.
Okay, let me try this.
Oh, you got it. Yeah, there we go. Nice.
Nice work.
No way!
That was pretty damn good. Well done.
Thank you. Oh my
And
god,
what
I
like
couldn't
to
believe
tell
that.
people too. So when
That's
it's
crazy.
hard when you're talking to like do it quite as well.
Yeah.
If you're struggling, even just lean forward more at the top. It kind of
Ah,
helps get you
okay.
over.
Okay.
When I do it well, though, what I like to do is you try to stay more upright, and then just really focusing on the push. So I'll do one where I shut up and
Okay.
I don't talk.
Dude, that's so clean. Good
And I tried to
job.
keep my torso a little more upright.
You know, I think
Versus-
one of the cues that you gave me was to keep the hollow body. I think that really
Yeah.
changed the positioning because I think before that cue, I was kind of like a bit flaccid in the core.
Yeah, you
and
went
then
in
once I
with an
hollowed
arch
in,
almost
yeah.
like the first ones, and then
Okay, let me try this again.
yeah, close the space on your front. You got it.
Nice. Nice work.
Solid. Well done.
I mean, my elbows are a little bit asymmetric when I'm like turning into the push, but I feel like that's a decent start. So how did you guys get into calisthenics in the first place? Is it just like a community kind of thing, or?
I did it for a long time, but not well. And I had videos of me doing muscle ups, I want to say, wow. So I'm 45, so I was in my 20s.
Okay.
And I'm like, oh, I can do 8 of them, but it was like every single time, pull, chicken, and then
Yeah.
I could do 8 chicken wing muscle ups.
Okay.
And so I went to work with Shawn because I actually wanted to do them well.
Ah.
Yeah, and I learned originally, like I learned the ones that you were doing first, the swing.
Yeah.
But then I was using the knee drive. You are way better at them than I was. And then I started strict.
You mentioned that you're 45.
Yeah.
So how have you noticed your body changing over the years in terms of like strength and mobility and also your ability to do these power moves?
Honestly, I feel better at 45 than when I was in my 20s.
Really?
Yeah.
Have you noticed any symptoms of like perimenopause yet?
Nothing.
Nothing? Okay,
Nothing.
wow.
I mean, I'm sure I do because I'm 45, but I had a DEXA recently. My
Okay.
bone density, I'm the most pleased with my bone density.
Great.
It was 2.9.
I don't know
Or it
scores,
was
but is
considered,
that,
it was like literally, it was like over the 100% mark. It was crazy.
amazing? Good job.
So we'll do just a pullover first, okay?
Oh, wow, high bar.
So from here, keep your legs straight, pull
Yeah,
up top. I'm sure you got that.
yeah, I can do that. Wow, it's really high. Dude, I don't think I can reach this. You jump from here?
Yeah, yeah. There's a here, if you want.
I gotta just try this.
There you go. That's the rock climber. Okay. So the goal is to bring yourself around. Oh, easy. Yeah. Nice. Come down and rest.
Okay.
Good. Nice. Now to get the transition, we will go in the lower bar because it's a little bit complicated just to learn. So don't let momentum or the mass of your body throw you into positions.
Okay.
Right? At the very top, I'm going to tuck my knees in and skin the cat.
Oh, okay, sick.
So you have one fluid motion.
Pull over, and then when you come down, you go into skin the cat.
Yep. As soon as you're at the top position where you would like finish a muscle up, you're slowly going to curl your torso around the bar, bring your knees through your arms, and then continue to skin the cat.
Okay, so go a little bit wide then, right?
Just about hip width is fine.
But,
Yeah.
Okay.
So just go really slow. You can go slow in this one.
Okay.
So come around. Oh, come right up. Yeah. Now tuck your knees into your chest. Yeah. Come through slow. And then slow. Extend down.
And then drop from?
Yeah. You just drop them now. Oh, nice. Nice.
Yeah.
Work. So
There's a lot of similarities between climbing and calisthenics.
this one's gonna be super easy for you.
It's so similar.
Because as you're reaching, you're lengthening and reaching.
Yeah.
So the big thing on this one, you want to be able to lengthen and get your shoulder above the bar.
Wow.
Yeah,
So how would
so-
you, but like if your hand's on the bar, how do you get it over?
So you gotta have your thumb on top of the bar on this one. You'll go into a really wide grip. Now, as you translate over, I'm gonna pull over to this side as I push down with the other arm. I wanna get myself above here, so it's a better position for the shoulder.
Okay.
Down here is not gonna be in the best position,
Okay.
right? Because as you know, through internal rotation, you close
So you're like,
Yeah.
you're literally like rolling it over
Exactly.
into this position like
Yeah.
that. Okay.
Yeah. We're trying not to minimize this and just more be here.
Okay.
Go on this one. We'll just show you first and you can try.
Yeah, totally.
So hollow body, legs together, pull.
Ah, you make it look so easy.
It's my job. I wouldn't want to perform surgery.
Okay, that looks awesome.
Oh, see? Climber. Okay, so nice and wide grip. Get your thumb
Is this wide enough?
hollow body, nice strict form. Now pull pretty fast. Oh, look at this, natural, easy. Easy. First try. Good work.
Thank you.
See? Typewriter, nice, awesome. Easy.
Nice.
Okay.
You guys do ropes in calisthenics as well?
I used to do the legless climbs.
Yeah.
We don't do too much ropes here, but he does
Yeah. Yeah, I feel like as a climber, it should be pretty easy, right? Can I
the
try?
legless climbs, I used to do that.
Like you just go like sitting down? It's funny, I can't even remember the last time I climbed a rope actually.
Even think about the bracing too. That'll, yeah, nice. Easy.
Boop. I feel like the form was kind of bad on the down. Thank you. I think I'm okay for that.
Yeah, the first prerequisite is can you put your feet together and perform the Asian squat? So can you sit down here in the bottom
Like this?
without any heel rise?
Oh, I can, yeah.
Not bad. Now with your torso, can you elongate your torso and get upright slightly more without your heels coming off? Now from this position, can you extend and hold your leg off the ground
Ooh, dang.
without falling over? Not bad. Okay, so you can get to the end range position. See? You got it down easy. Yeah, you got it down easy. So then to start from the top position, you're gonna go here. You're gonna hinge forward slightly.
Yeah.
Pull yourself down into position, hold, and then drive back up.
Damn.
Now the big thing is control, right? We don't want gravity to just throw you down and bounce out, right?
Yeah.
You wanna maintain control. So come over here.
Nice.
Push. Up. Good. Better.
I'm
better.
losing balance on that.
Yeah, you're still going back slightly.
Yeah.
More midfoot.
Yeah.
Midfoot,
You're-
okay.
You can see how you're shifting to your heel.
Yeah.
Once you shift off of that tripod foot, you lose the stability and strength. So
Okay.
try to maintain more toe pressure and midfoot.
Toe pressure and midfoot. Okay.
Yeah. Punch forward, reach forward. Now push the floor away. Ready? Drive. There it is. See?
Way better.
That was good. That was sick.
My
Nice work.
balance, I feel
That
like
was
my
good.
balance is really bad on that, on the push.
Let's see this side. Nice work.
Okay.
That was
you
way
know, I
better.
feel like it's got to be like maybe
Yeah.
you have to like warm up to this because I feel like
It is. It's
that last
positional
one-
too.
Yeah. Okay. Let me try this one.
Yeah. Nice work.
Okay.
Nice.
That feels
Yeah,
better.
a lot of it is with stability. So with increased stability, you can produce more force, right?
Yeah.
The second you're unstable, the second you will not produce force in the right direction, like you started going backwards.
Okay.
And that gives you a mechanical disadvantage to actually come straight up.
Yeah.
So let's try dragon pistol. Now this is going to be like, you know,
these are-
this is like throwing 100 on red. We'll see.
Okay,
Okay,
let's- let's see it.
Okay, with the dragon, you want to still maintain your balance on your foot. You're going to grab onto your toe, put one arm in front for counterbalance.
Okay. Wait. So I'm holding my left.
Your big toe.
Okay. I'm holding this.
Yeah, now you're slowly coming down. I'm locking my knee behind my other knee. I'm slowly lowering and then extending my leg in the bottom
Dude, I don't know
and
if I'm gonna
hold
be
that
able to-
bottom position.
I don't know
Now
if I'm
from
gonna be
there,
able
you
to
can
do that.
push and come back and hold.
Dang. Okay.
Okay?
Okay. Let me try that.
So there is a ton of progressions, but we're just gonna go right into it for you. We're just gonna go right into it.
So I'm here. This is
So
out.
lock your knee behind your other one. Now slowly come down, slightly lean towards me. to
dude,
maintain-
it's so
hard,
weird.
right? We can give you, yeah,
It feels,
elevated. We'll give you progression, 1 second.
let me try this one more time. Let's see. Okay, so you're holding your toe like quite strong, right?
Yes, really strong, yeah. We
Because
can
I
give
feel
you
like
progression.
the tendency is for me to like just let go of my toe.
Yeah, so think like you're grabbing on like this to your big toe like that. Now with this knee, it's really important to lock it behind your other leg. This will give you a lot of support. As you lower like that, you can slowly start to extend in the bottom. I'm here for balance if you need it.
Oh, dude, I can't.
Okay.
I can't like
Try on here, try on here.
get my legs like to flex like that.
So there's a progression we could do with also a band. You don't have to, but just put it there. Grab pretty high though, you need a lot of help. Okay. Grab up there. Okay, so maintain your balance there. Keep midfoot pressure. Bring this knee behind the other one. Slowly tilt towards me, don't extend yet. Come down lower. Now start to extend. Yes.
oh, okay.
And now flex the leg and come back up. Yeah. Up.
Dude, I can't.
You got it, you're so close.
Man, that's so
You got
hard.
it though, try again. Come on, get down low first. And then flex the quad, yeah. Lean forward a little bit and then come back up. Push. Nice. Easy, you got it, that counts.
Oh my goodness.
Nice.
So what would you guys say is the benefits of doing calisthenics over just like powerlifting or like, you know what a lot of people do is like bodybuilding these days, right? Like,
I find calisthenics, it has a carryover to everything. You see people who do calisthenics, they're usually fairly good at the bodybuilding and
Yeah.
at the powerlifting, obviously with a bit of training.
Yes.
But you see bodybuilders and powerlifters aren't good at calisthenics right away.
Yeah, the transferability is not the
Yeah.
same. I feel like the better you have, so something called internal strength, you ever heard about that? So your internal strength is the strength you have within your shoulder capsule, your hips, your knees, your ankles. That internal strength transfers to any aspect you do. So the better control you have over your internal environment, the better you can display that strength through other modalities.
Okay. Yeah.
Versus if you're moving, say, just weights around, that person will not pick up calisthenics as fast as the calisthenics guy picks up weights.
Okay.
Right? It does take time to build strength,
Yeah.
but I found the easiest people to coach over the years have been people that do body control movements. So rock climbers, dancers, gymnasts, right? Anyone that moves their body, they pick up specific skills and get in more efficient positions so much easier.
okay.
Yeah.
Yeah.
And so you're gonna do this viral challenge. You're gonna do it.
So go both
So,
hands?
Underhand grip here
Yeah.
with your hands there, yeah. Now your goal here is to get your elbows in, go on your ASIS on each elbow. Yes. Now extend your T-spine. Nice. Hold that position. Now tuck your chin and go into your shoulders and go right into a dragon flag. Legs together. Nice. Tuck your chin. As low as you can. Now when you come back, keep your body together. Don't flex the hips. Bring your elbows in and go onto your elbows. And then chest up. Hold it. First try, this guy. Nice work, bro.
I feel like I need to clean that up a little
That
bit.
was sick. That was so good.
Whew, that's hard. Yeah.
Yeah.
Yeah. Elbows in, you got it. You got it. Yes, there we go.
Nice.
Well done.
Oh no!
That was still counted. That still totally counted.
Thanks.
I'm gonna try one more.
Oh man, okay, I gotta try that one more time. The first time I was going too fast when I came out of it, and then the second time I was going too slow, where it's like, you know?
Makes such a difference.
Yeah.
Like the controlled speed.
Okay, I'll try it one more time. Oh, thank you. Whew. All right, let's go. Yeah.
Okay, so we're gonna pretend you don't know anything about this, right?
I literally don't know anything about this.
So we're gonna step on.
Don't have to pretend, man.
All we're trying to do, so to maintain balance, now one trick to really work on the hand balancing with parallettes anyways, is come beside me here and grab onto this parallette. Now what I want you to do is put pressure in this part of your palm and push that side in by just
Like
using your
this?
wrist. Exactly. Now just use your wrist and go backwards.
Backwards.
This is gonna be how you're gonna balance forward and backwards. So you feel how this weight distribution changes between the front and back part of your wrist?
Yeah.
You're going to push down and push down.
Okay.
So if I'm falling this way, so if I'm on the parallettes doing a hand balance, I fall this way, what do? I push down and drive myself back. If I'm falling back this way, I drive back.
Okay.
Make sense?
Yeah.
Okay, so with the curl, we're gonna go hands near the edge here, put your toes on. We're gonna make a shelf for your knees, and we're gonna go 1 foot, slowly come up, next foot, and bring legs together. Exactly.
Okay.
Now, if you ever
and your
notice,
eyes are on the ground in front of you?
yeah, my eyes are right there. If you ever notice you have to like jump off the ground, you're not in the right position. You should translate your weight forward. So see how I'm just sort of hovering forward?
Yeah.
My leg, I'm not pushing, I'm just lifting.
Okay.
Just balance.
Okay. Let's try that.
Yep. Now you're gonna bend your elbows to make a shelf for your knees, so make sure you flex
Right
your
here?
elbows. Yep. Now slowly come forward, squeeze on with your hands, and then we're gonna pull one heel. Really slow, go slow, go slow. You got it, you got it. Slow, slow. Now flex your knees. Yep.
There you go.
Hold that position. Give me 3. Breathe. 2. Own it. 1. And perfect. There it is. Rest. Awesome.
Man, I felt like I was gonna like tip forward and fall.
That's the feeling when you first learn. Is
Okay.
you're not used to that whole center of mass forward.
So is this how you learn how to do a handstand
It's
on
the same
T-bars?
hand training position. Yeah, same
Same-
thing.
okay.
So the deviation in your wrist back and forth, that's the same position you're gonna be when you're upside down.
So is this how you, I guess, like progress into handstands on bars?
Exactly, building up the motor control and the awareness to actually go back and forth. Now
Okay.
the next phase is when you're in the position, you wanna be able to own it. So if you're in your crow, I wanna be able to translate weight forward and backwards.
Oh, whoa.
And side to side.
Crazy.
So when I'm upside down, I'm able to feel what it's like
Crazy.
to translate that weight back.
Dude, that looks so sick.
Let's see,
so crazy.
let's see you get it by yourself.
Okay, let's try that.
So go to your basic crow first. Yeah, there you go. Nice and slow. Yeah, I got you. Nice. There you go.
Oh, okay.
Nice.
Okay, I kind of
got
understand
it.
this. So when you, okay, I think you can release.
Yeah, there you go.
Oh shit.
Nice, you got it.
Okay,
That's pretty good.
I understand. So like when you're extending your elbows, there's like a lot of, you're actually having to move your wrists at the same time to find that counterbalance.
100%. Yeah.
Oh,
I'll
it's
do it again.
so-
Stand on the side for a sec. So I want you to watch where like majority of my body moves. I'm tucked into a ball. I'm going down, going up. So I'm sort of flexing the elbow
Interesting.
and extending.
Yeah, there's so much going on in your wrist when you're doing that.
A lot of deviation. Honestly, yeah. Nice and slow, man. Nice and slow. Nice, you got it. He's gonna go into single leg in a sec. Okay. Nice, man. Nice. That's really good. It's just subtle movements. That's really good, man. You learn really fast.
It's really hard.
Nice. So we're gonna translate your weight now laterally to the side and take one knee off, okay?
Okay.
So hold your crow, balance it, shift over to my right, bring this knee in and hold.
So so when you're shifting, how are you, is it just like a movement in your shoulder? Like
Yeah,
how,
so what I'm doing is I'm taking my body position and shifting over to the right side, and I'm flexing the hip to bring the weight of my leg close to my wrist. Just the butt. Nice. I'm gonna spot you a little bit. Lean forward. Yeah.
it's like, it's so hard to like,
You gotta hinge forward a little bit more.
hinge forward
Yeah.
more? Okay. Because I feel like there's so much pressure on the anterior
It's a
delts
lot.
in this thing.
Yeah, it's a lot.
And you can like, I guess, lever into your elbows
Yeah.
as much.
You wanna take as much weight off with your joints stacking. So if your joints are stacked, you don't have to have as much effort.
Okay, I'll try this again.
Try your best. This is hard though, this one's hard. You got it, brother, let's go. I'm gonna spot you, you got it. Yep, keep that lean forward, nice. Yeah, bring it off. Nice. Bring it back. Bring it back. Nice work.
It's so hard to like bring it back and stack it on.
Yeah.
Yeah.
Just take practice. I don't expect you to get it the first try. This was one that takes a while to practice, right? You want to try? Have you done this?
Sure. Yeah.
Go for it.
I have not done this in a very
It's been a long time. Right?
Progress, not perfection.
Yeah, exactly.
Come on, Meg. Shift, shift, shift.
You got it, Megan.
Good.
Nice. There you go.
Amazing.
Nice,
Good
Megan.
job.
Solid.
Good job. Yeah, I think one of the biggest things that I've taken away from this session is how helpful positive feedback is for all these movements. Like the biggest one that I did not think I would be able to do is a slow muscle up, but there were like a few cues that both of you guys gave me that helped me unlock that movement. And I feel like, you know, see a lot of things on social media, I'm like, oh, I should try that. And then like, you know, actually taking something from like seeing it on Instagram versus actually executing in your own body, there's like a huge gap, right? I don't think I would have unlocked the slow muscle up for months unless I did the session with you guys.
Yeah, have some cues.
Yeah.
It's also how to interpret the cues, because you can give the same, so say you watch Instagram, you see a cue, that cue can be interpreted 10 different ways. It's the outcome you're trying to achieve from that cue is the most important, right? So we're trying to get you a certain cue, say your elbows are out here, we're trying to get you in, we'll give you a cue for that outcome. And how you interpret that cue, we can visually see that, and we can make adjustments based on what you do. And that's the big difference. Yeah, that's a big difference.
Like what I say to you might be useless,
Yeah.
but for you it might work right away.
100%. And knowing that for each person is the biggest thing. Knowing how to give the right cue to get the right outcome.
How feasible it is for someone to walk into a gym like this and actually start doing calisthenics?
It's all just like from this assessment, we see what their capacities are, what their limitations are, and base a modified plan based on what they're bringing into the bar. Their baseline is going to be their worst they're at. We're only going to get better from there. So it's seeing where the person's starting at. I've had someone even do push-ups on a wall. So they literally just go into a wall, do their push-ups on there, or do bodyweight rows almost standing up, and then over time they're progressing past that.
So can I ask how far that person was able to progress? Like were they able to do like a full push-up later on? Or?
Yes, so about a year and a half, the person was able, he's 56 years old, the person was able to do a full push-up on the ground, all the way down, all the way up, and we had to do a lot of shoulder rehab, a lot of building capacity and building awareness for that person to be able to get there. So it's not even just strength-based, because anyone could just throw exercise at people. It's building the capacity and the motor control to get them moving smoothly. That's the main thing, right?
I think another thing that I see in the ER very frequently is people who, you know, as you age, your balance gets a little bit worse, and everybody will kind of trip and stumble on small little imperfections in the ground. But if you have strength and the reflexes to actually adjust, and also if you do fall, you want to be able to catch yourself, and you know the thing that's going to help you do that is being able to do a push-up. But I see so many people that are over the age of 60 that fall forward, and literally their face takes the full impact because they just have no strength to push, right?
I think the big thing is people wait for that life to hit them, for that area of life to hit them before they say, like, oh, I need to make some changes, right? It's like hindsight, right? It's like you should have done things. It's like you drive your car for months and months with all these check engine lights on, and until it actually breaks down, you're like, oh, I gotta get it fixed. Right? But if we reverse that and we take care of our body and do prehab, so preventative measures of rehab, which is not too talked about. Rehab is the big thing, right?
Absolutely.
When we take care of our body before that, we should be good.
Totally.
Right?
Like even strength training is technically it's rehab.
100%.
Prehab, rehab, whatever you want to call it.
100%, definitely.
It's not like you just have to go in and do physio exercise.
No,
totally.
build some strength.
Well, thanks so much for joining us for this video. I think this was a very enlightening session for me, and calisthenics is definitely something that I want to continue pursuing over the next year. I hope you'll join me on this journey, and you know, I love to continue working with the two of you and you know, track my journey. And thank you so much for coaching me on the session and teaching me all these different skills. It was so much fun.
You did great. You did great. You did really good. You did really good. Yeah, you did amazing. You did every skill I think we taught you. You aced it.
Love it. Yeah. Good work. Great. Can I give you a hug?
Yeah.
All right. And thank you for what you do as well too.
Thank you.
You
Yeah.
appreciate it.
Appreciate
Make a
it.
difference.
And
Appreciate it.
it's a good role model for your patients.
Yeah. I try my best.